So this is St. Bartholomew's Hospital in London, or St. Bart's for those who know it well. It has been around since 1123. So in 5 years, it will be 900 years old. And it's the oldest hospital in England, and one of the oldest hospitals in the world. I've had the opportunity in my time as a healthcare strategist and a consultant to visit dozens, if not hundreds of hospitals around the world. And I have to say, this one is exceptional. It has a grand hall with murals that were painted by some of England's best painters. It has an inner courtyard with a fountain, which is a very peaceful place to sit and eat a sandwich. And it has the only statue left in the city of London of Henry VIII, who made sure that the hospital endured even after the dissolution of the monasteries took away its source of financial support. But the thing I really love about the hospital is not just the building or the technology that you see when you go inside or the care that's being delivered there. It's the people that really make the difference. The doctors and the nurses, the reception staff, the porters, everyone working together with a sense of mission and purpose, which is to help heal people who need healing. But my goal is actually to make all of this obsolete, so that we never celebrate the 1000th anniversary of St. Bart's Hospital, but instead celebrate the fact that we have a different way of experiencing health and healthcare in the future. And I think it all boils down to 3 core themes that we have the tools today to really transform the way healthcare is delivered in the future. So the first theme is value. And when I say value, a lot of people immediately think money. And that's understandable. When you look across the developed countries since the 1950s, the spending in all of those countries on healthcare has been growing faster than the economy as a whole by about 1 to 1.5 percentage points. In the US, of course, it's even more extreme. It's 2 to 2.5 percentage points. So that now about 18%, or 1 out of every $6 in the economy, is being spent on healthcare. And that might not be a problem. Maybe that is a good use of resources if what we want to do is lead healthy, productive lives. The problem is we don't get the same return for that money that we think we should. So as this spending has risen and risen and risen, we haven't seen people living healthier and healthier lives that are directly attributable to all this spending. And in fact, countries with much lower rates of spending on healthcare are doing better than we are. So money is a problem, and hospitals, by their very nature, are large consumers of money. And so one element of the future of healthcare has to be to think through how we think about value and the cost of healthcare. But when you think about the value of anything you buy, it's not just about how much it costs. It's also about what you're getting out of it. And in healthcare in particular, the first thing that we think about is safety. And when I think about safety, or when a lot of people think about safety in healthcare, we think about airplanes. Why do we think about airplanes? Well, airplanes in the 1950s and 60s were incredibly dangerous ways to travel around the country. Crashes, fatal crashes happened all the time. We live in a world today where airplane travel is reaching unprecedented levels of safety, so that there have been no major commercial airline crashes in the US since 2013. But if we look at hospitals, there are an estimated 200,000 preventable deaths last year alone from medical procedures and errors. So if you put that into the airline context, that would be about 3 fatal crashes a day. So think of that. 3 fatal airplane crashes a day, we would never find that acceptable. But somehow in the healthcare industry, we've come to accept that as one of the acceptable faces of value in healthcare. And Sarah Cliff, a healthcare journalist who I respect a lot, wrote recently about 2 different models of healthcare. One that treats hospital-acquired infections and those kinds of diseases as airplane crashes, things that need to be thoroughly investigated and rooted out at their source. And the other group of hospitals she calls car crash hospitals, because sadly, we think of car crashes as also being something that happens on a day-to-day basis. And we don't send a team of federal investigators to investigate every single car crash unless, of course, AI is involved. So there's an opportunity here for us to really change the value that we get from healthcare by thinking about how to create it safe, make it safer. And one of the lessons that we've learned over time is that hospitals are just not safe places to be. So hospitals have infections, they give you exposure to other potential diseases. They also take you away from your support network and your family, your day-to-day life. A lot of older people will live successfully outside of a hospital for a very long time. And then after a relatively trivial accident, like a hip fracture, they suddenly start a downward spiral. And after that, there's no going back to the healthy life they had before. So when we talk about value in healthcare, I think safety is where we have to start. But safety isn't the end when we're talking about quality in healthcare either. What we're also expecting when we go and get healthcare is an outcome. So for some people, it's to be able to go running in the hills again with their loved ones. For others, it just means less of the pain and suffering that they're experiencing on a daily basis. Right now, we don't have robust ways of measuring the outcomes that we get for the money that we spend. We have proxy measures. We know how much we've done to someone. We can measure also the safety. But we don't know really, was someone's life better or worse from these interventions that we've made. And just yesterday, I was talking with some friends about the history of heart stents. And so for those of you who don't know, when a person develops coronary disease, they often will have stents put into their hearts to help the blood vessels continue to pump blood. And over time, there have been a number of innovations in the area of heart stents. One was drug-eluting stents. And in the late 1990s, that was going to be the future of cardiac care, was that everyone was going to get these drug-eluting stents, and then you would never have to go back and do another surgery because the stent had clogged up. What they found over time was that actually, over several years, the rate of having to go back and perform what they call a revascularization was no different for patients that had a drug-eluting stent or what they call the bare metal stent. But there was more than a threefold difference in the cost of the stents that they were putting in. So without a really strong sense of how we measure the outcomes of healthcare, we're not going to get a handle on the value side of things either. But when I think about value in healthcare, it's not just about how much does it cost, is it safe, and does it result in the outcomes that we want. It's also about our experience in healthcare. Healthcare is an enormously personal thing. And everybody wants to get the best care experience that they can. But what does that mean? Some places think that it means that you treat a hospital like a hotel. And it involves concierge services, it involves luxury food menu selections, or it could involve your choice of different kinds of pillows or comforters or those kinds of nice amenities. But when we did work when I was at McKinsey about what makes a difference in terms of a patient's experience of care, the number one thing that came up was they want to know what's going to happen next. They want some sort of navigation for the care that they're experiencing. And hospitals are really bad places to get that kind of navigation. All the departments are broken up one at a time. And so patients would often be told to just get on a bed or a gurney and be wheeled down the hall, and literally they don't even know where they're going next. They don't know what to expect. And this is one of the things that makes hospitals such terrifying places for people to be. So as much as I love hospitals, I don't think anybody really enjoys being there as a patient. And part of that is because of this patient experience part. Most of us don't even think about the safety issues. We assume that the outcomes are going to be good. But we know how terrifying it is when we don't know what's happening next. And so I really think that if we want to try to address the future of healthcare, we're going to have to fundamentally change our approach to value by addressing the safety, the quality of outcomes, and the patient experience, as well as the costs. But another reason why I'm optimistic about the future of healthcare is, this is a cemetery. So this is part of my story that's a little bit more complicated. So the reality is that we all die. And cemeteries are also beautiful places, almost as beautiful as hospitals, but most of us probably don't want to spend a lot of time there either. One of the things that I think is going to be transformative is when we can understand and have conversations about the end of life that really reframe our understanding of what our values are in healthcare. And so recognizing that it's been estimated that about 80% of Americans say that they would rather die at home than in a facility or a hospital setting. And yet 60% of all Americans do die in a hospital. And a huge amount of money is spent on the last year of life. Again, there may be questions about how much of that is really consistent with the values that we hold as a society. And so I do think that addressing the fact that we do ultimately have an end of life is going to be a key part of answering this question. But what makes me more optimistic is actually the role of technology. And so this is a computer reading a book. Could be a metaphor for Watson. There were some grand ideas after Watson won Jeopardy contest and that it was going to transform healthcare. And what we really needed was just some sort of machine that was smarter than doctors and could do things better than them in terms of diagnosis. And the results so far have not been promising. But that doesn't mean that there isn't a potentially huge role for digital and technology to play in transforming the way that we experience care in the US. One example of that would be this device. So I'm guessing a lot of people in the room don't even know what this is. It's a fax machine. And again, I was having a conversation just yesterday with some friends about fax machines. One of them said, I had to send a fax the other day, and no one in my office even knew that we had a fax machine, but I found a device that had a copier that had one in there. And then we realized that nobody in the office actually had a cover sheet to put on the fax before we sent it, until finally someone dug around and found one in an old file someplace. And my other friend said, we use fax machines every single day at work. So can you guess which one of those is a doctor? It was the second one. The fax machine is still part of the way that we do business in healthcare. And there are a lot of different reasons for that, but one of the core of them is that we really haven't seen the full promise of technology when it comes to healthcare. And so we have electronic medical records that don't speak to each other. We have systems that say that a fax machine is somehow safer than a digitally authenticated prescription order for an opioid or some other classified drug. And so these are the devices that we use instead on a day-to-day basis. So the digital transformation of healthcare is not necessarily that the computers are going to be better than doctors at diagnosing those very rare, very unusual diseases that you hear about on House. But it's going to be through transforming the back office as well and making sure that these things like fax machines are as unusual in a doctor's office as they are in any other kind of office. But it's also about using machine learning and AI to change the way that we deliver healthcare and to figure out which are the interventions and which are the treatments that really have the best potential for human beings. And again, I think as we've heard from other speakers earlier today, the question really is not, can the machines be trained enough to make recommendations about how healthcare should be delivered? It's about how do we make sure that that's done in an ethical way that really matches our values as a society. But once we add these digital tools, a lot of the care that needs to take place in a hospital setting today can be freed and can be actually delivered by family members or other caregivers in a patient's home or in a setting that's just more conducive to overall health and wellness than a hospital is. So how are we going to get there? I said we need to focus on value. We need a digital transformation of healthcare. And again, I think I'm certainly relieved to hear this is a consistent theme. We'll get there through teamwork, right? This is not the work of doctors or healthcare strategists alone. It's work for all of us. One part of that is making sure that physicians are working together. So again, because of the long tradition of the way that healthcare has evolved and medicine has evolved, we each see a series of different specialists if we have a range of different conditions. And I had a friend who had this experience taking care of an elderly neighbor where his days were consumed with doctor visit after doctor visit after doctor visit, and the only person who was keeping all of that information together was my friend, who was not even a family member of the friend that he was taking care of. But he was the one who said, oh, well, the physical therapist said this, and the orthopedic surgeon said that, and his cardiologist says that he has this problem. How do we actually create a care plan for him that works together? And his neighbor was incredibly lucky that my friend was retired and was able to take the time to take care of him like this, but that shouldn't have to be the case. We should have care teams that really bring all of the medical specialties together. But again, I think as we've heard, it's not just about the doctors who know best. It's about the entire care team, and everyone has a role to play in delivering that care, and it also has to be focused on the patients and the families and what they want and need, so that we know that the money and time that we're spending in healthcare is really matching up with what is the highest priority for those family members. Finally, I'd say it's about, again, society as a whole. So there's been a lot of research into what are the determinants of health. And a lot of people are shocked the first time that they learn that hospitals and healthcare, the healthcare system as a whole, is only a small fraction of what determines the overall healthiness of individuals. Much more has to relate to the environment that we live in, the kind of toxins that we are exposed to or not, our genetic disposition and what diseases we might be more likely to encounter than others. It has to do with our gender and ethnicity. Each of those play a role in terms of what kinds of healthy or illness issues we might face in our lives. And of course, it has to do with our socioeconomic status. As we have more material wealth, we can shield ourselves from a lot of the negative impacts of poor health. And then finally, it also relates to personal behaviors. And all of these factors together play a role in our health, but as we get to know more about them, we can actually start to address some of the root causes of why we get sick in the first place, and hopefully address those things in a way that brings more value to everyone in society. So in conclusion, my goal is really to do away with these bright, shiny hospitals. This is the Royal in London as well, the sister hospital to Barts. It just went up in the last 4 years, and it's a beautiful edifice. But I'd like to see the day when this is just another office building instead of a hospital. And by really focusing on better value, making the digital transformation real, and working together as a team and a society, I think we can fix the problem of healthcare for the future.